Welcome back to Appletree U. In this segment, we're going to cover an overview on how a basic diagnostic hearing test is performed and how it's read. If you haven't had a hearing test yourself, you're not alone. We did a survey of 10,000 patients and found that only 2% had had a hearing test in the last 10 years. That's because hearing tests aren't often done in schools or in places of employment anymore. This is too bad because without doing a hearing test, it's very hard to catch early those people that have either tumors or other pathology that affect the hearing and that are treatable. Also, it's very hard to diagnose certain conditions without being able to test the hearing. Finally, for people who have noise-induced hearing loss, it takes a long time before people recognize the symptoms of hearing loss, and yet the earlier you treat someone with hearing loss, the better the results are. Because if you go a prolonged period of time with hearing loss, the connections between the nerves that are supposed to carry the sounds and the brain where it interprets the sounds, those connections can be lost. If they're lost for too long, they tend not to regenerate. And this has all sorts of impacts on people, from their memory to their moods, when they start missing increasing parts of conversation, television and shows, and just general life. So what we're going to cover in this short video is how to actually look at an audiogram and how to understand what it is telling us when a patient has done what's called a pure tone audiogram. Now, pure tone and hearing in general is going to introduce a lot of different terms. Pure tone reflects how we measure someone's hearing. Interesting enough, they discovered years ago that when people start to lose hearing, they don't actually lose the hearing in the full spectrum of their hearing, in all of the frequencies. And so they came up with a test where essentially, and if we look at this graph, where when you test the right ear and the left ear, what you're comparing is at a low frequency, how well can you hear, and then going to middle and then higher frequencies. And by putting a graph format, you start to see patterns that you wouldn't otherwise discern just from the numbers. Now, let's go over a few terms. First of all, when you're testing the right ear, we're going to mark our findings with O's, and when we test the left ear, we're going to use X's. We're going to put the results of both ears on the same graph so that we can see whether whatever pattern the patient has is symmetrical. That's important because if someone has an asymmetrical hearing loss, in most cases they should be referred to an ear, nose, and throat doctor for more advanced testing to rule out more rare and more difficult to treat conditions. Now, what is a decibel? A decibel is a measurement of sound. A louder sound is represented by a higher decibel level. So if you're listening to your music really loudly, you might be listening at 70 decibels. Whereas if someone is speaking very quietly, they might be speaking at 20 decibels. And normal speech comes in somewhere between 20 and 30 decibels. Now, what do the different frequencies mean? Well, this is a very low sound. I don't have a very low voice. My lowest low probably is somewhere around here. As you go to higher frequencies, you get into normal speech. But then as you get into the higher frequencies, you run into connector words like s. And the importance of that is that when people lose their hearing, they usually lose it in the higher frequency range of sounds. And you'll hear people complain that females, like that female news person, she speaks too quickly. What that person with hearing loss is saying is that when the male is speaking, all of the sounds are slightly lower frequency and they can hear them, but when the female is speaking, they're missing the connector sounds. So it's almost like when you're learning a different language and everyone is speaking too quickly. because your brain doesn't yet know how to process the connector sounds. And so I'm going to show a typical test. What we do is this, is we start with a very low frequency, and let's say 500 hertz. At 500 hertz, we'll start at a decibel level that's quite loud, say 60 decibels, and then what we'll do is we'll ask the patient, can you hear it? And they hit a little button that says that they heard it, and we'll go to 50 decibels, and then we'll go to 40, and then we'll go to 30. And what we're doing is we're getting quieter and quieter on that frequency only. And we are actually seeking the threshold at which they can no longer hear that sound. In fact, this is called a pure tone threshold test, because what we're then documenting is the last quietest sound at that frequency that the person could hear. So let's say that this person was able to hear at 50 decibels, 40 decibels, 30 decibels, 20 decibels, 10 decibels, but couldn't hear at the lowest range of, at the lowest sound that most people can hear. Then we mark the one that they could hear. So let's say in their case it was 20 decibels, and we're testing the right ear. We put an O there. We then go to a slightly higher frequency, and we test again. And we go 50 decibels, 40, 30, 20. Oh, they couldn't hear 10, but they could hear 20. Then we go to a higher frequency, and on until we get to a very high pitch or a very high frequency. And what you'll see is this. In people with normal hearing, they tend to have the same decibel threshold at all frequencies. And they tend to have the same decibel threshold in both ears. So when we test the left, their threshold at 500 hertz frequency is 20 again, 20 decibels, etc. It may vary a little bit, but it won't vary a lot. This is, or represents, normal hearing. Now, if you have normal pure tone threshold testing, if your results are normal, which we view as any result that's bilateral, that's symmetrical, that is 25 decibels or less, anything above this line, we consider that to be normal. With hearing testing, there's really only one main pattern that you're going to see frequently. Any other pattern, the doctor will generally refer to an audiologist or to an ear, nose, and throat specialist or to a hearing instrument specialist who does hearing testing. Here are those patterns. If we see a patient where we're testing and at the low range they're okay, but we see that they can't hear at the higher frequencies anything quieter than 60 or 70 decibels, this pattern is consistent with noise-induced hearing loss. A lot of people are familiar with age-induced hearing loss, and that term seems to have fallen out of favor for a variety of reasons. But the reality is that this is the common pattern that is also correctable through the application of a hearing instrument of some sort, and there's many different types. This pattern, if it's symmetrical and both ears have a similar pattern, not always identical, but very close, this pattern of noise-induced hearing, the patient should be referred to a hearing instrument specialist who does more advanced testing and has different equipment. If, on the other hand, only one ear shows a loss the doctor in general would refer this patient to an ear, nose, and throat specialist, and most audiologists tend to work in an ear, nose, and throat practice. So they would then see the audiologist at the ear, nose, and throat practice. Now, there are other patterns that you will see. There's a cookie bite pattern. There's many other patterns that are way beyond the scope of what a family doctor would need to know and what a medical assistant would recognize. The key thing to remember is that if you have a noise-induced hearing loss that's symmetrical, they go to a hearing instrument specialist. If they have an asymmetric pattern of any sort, the safe thing is to have them sent to an ear, nose, and throat doctor. If it's normal, then they should just have a routine test done, depending on their age and depending on their occupation, or if they're exposed to loud noises and are at risk of noise-induced hearing loss. There are different time periods, and the doctor can advise the patient on that.